Peripheral arterial disease is a progressive circulatory condition. It results in clogged or narrowed arteries, which leads to poor circulation to the arms, legs, brain, or kidneys. Peripheral arterial disease occurs most commonly in the lower extremities, which leads to decreased blood flow in the legs and feet. Additionally, it does increase one's risk for heart attack, stroke, or amputation. Eight to 12 million Americans currently suffer from PAD. 1/3 of smokers over the age of 50 have peripheral arterial disease. 1/3 of diabetics over the age of 50, and 1/3 of patients that are over 70 years old. 75% of patients that have PAD also have heart disease. And there is a mortality rate of over 30% within 5 years. Without treatment and early intervention, peripheral arterial disease can lead to the following conditions: resting leg pain, non-healing ulcers, gangrene, amputation, and an increased risk for heart attack or stroke. In terms of 5-year mortality, patients with PAD have a lower survival rate than patients with breast cancer or Hodgkin's disease. In fact, cardiovascular disease accounts for more deaths than cancer, infection, and trauma combined. So let's take a look at who's at risk for peripheral arterial disease. All of your patients that are 70 years or older are at risk for peripheral arterial disease. And any of your patients that are 50 and older with a history of diabetes, high blood pressure, high cholesterol, and smoking. So later on in the webinar, we're going to take a look at what we should do with these patients that present with risk factors. Here are some other secondary indications for peripheral arterial disease. Patients that complain of foot or toe pain, especially when they're sleeping. Patients that have toes or feet that are pale, discolored, or bluish. Your patients with diminished or abdominal pulses. Patients that have had a severe injury to the legs or feet. And those that have diminished or absent hair growth. So here's a list of primary indications for a PADnet study. Patients that have claudication or pain while they walk. Patients with rest pain, ulcerations, gangrene, trauma to the lower extremities, embolism or thrombosis. A typical PADnet study takes about 20 minutes to complete, and it enables earlier disease detection by performing pulse volume recordings and segmental blood pressures that are used to calculate the ankle brachial index, or ABI, toe brachial index, TBI, and segmental brachial index, or SBI. The ankle brachial index is determined by dividing the ankle systolic pressure by the arm systolic pressure. The normal ABI range is 1.0 to 1.4. An ABI of less than 1.0 can indicate narrowing or blockage of the arteries in the legs, and that increases the risk of circulatory problems, and it possibly causes heart disease or stroke. Pulse volume recordings are images that evaluate the blood flow through the lower extremity. A normal PVR waveform is characterized by a steep upslope, a narrow peak, and the presence of a dicrotic notch in the downslope. Here we have some codes that can be used for billing your PADnet study. The first code is 93922. When conducted at the ankle, this study has two components: ABI values and the waveforms from the ankle. This study generally reimburses around $100. The CPT code 93923 consists of ABI values and waveforms at 3 or more levels. And this code generally reimburses around $125. And then we have CPT code 93924, which can be billed if you perform the study at rest and again post-exercise. And this generally pays around $150. So next we're going to take a look at chronic venous insufficiency. Chronic venous insufficiency, or CVI, is a disease that is progressive in nature. It's caused by damaged valves in the veins or venous blockage. More than half of all venous ulcers do require prolonged therapy that lasts more than 1 year, and it can lead to more serious conditions if it's left untreated. Over 30 million Americans are affected by chronic venous insufficiency, but out of those 30 million, only 1.9 will seek treatment. Without treatment, those with CVI may experience progressive symptoms that can be debilitating and that can significantly impact their quality of life. More people actually lose work over vein disorders than from artery disease. Without treatment, chronic venous insufficiency can lead to leg pain, fatigue, and heaviness, pigmentation changes, varicose veins, swelling, and cellulitis. Eventually, blood pooling or stagnating in the blood vessels can also cause ulcers to develop. Venous stasis ulcers form when drainage of fluid is inadequate. Malfunctioning valves in your veins allow the blood to stagnate, and this can spell trouble because when blood pools, it can clot, causing superficial clots or phlebitis. A pulmonary embolism usually happens when a blood clot called a deep vein thrombosis, or DVT, travels to your lungs and blocks a blood vessel. This leads to low oxygen levels in your blood, and it can damage the lung and other organs and also cause heart failure. Finally, when veins become distended with blood and weaken from chronic pressure on them, they can hemorrhage or burst and cause internal bleeding. Here we have a list of risk factors for CVI. Your patients that have a family history of CVI or deep vein thrombosis, patients that are 30 years or older, patients that stand for long periods of time, sit for long periods of time, or do a lot of heavy lifting, your patients that are female, especially those that have had multiple pregnancies, anybody with prior blood clots in superficial or deep veins. Obesity is a risk factor for CVI, or those patients that have a sedentary lifestyle, and your patients with high blood pressure and limited physical activity. Indications for chronic venous insufficiency include varicose veins with ulcer, varicose veins with inflammation or infection, varicose veins with pain, swelling, and or edema, phlebitis, and embolism. Venous testing in PADnet is super simple. It normally takes about 5 to 7 minutes. You will have your patient perform a series of dorsiflexions with their foot in order to empty their vein. And then the refill time is determined on screen while the patient rests. This is a reimbursable study. The code for this study is 93965, and this code generally reimburses around $100. Next, we're going to take a look at marketing materials. Before we do that, I'm going to pull up a quick poll. I'd just like you to click off how many of these apply to you. So the poll is going to show up on your screen in just a moment. And I'd just like you to check all that apply to you. You can make more than one selection. I'd just like to get a feel for how many of you are currently utilizing the marketing materials. So I'm just going to give it a minute for everybody to select their choices. Okay, so what it looks like is we have a lot of you that do have the brochures in your waiting room, which is great, but we don't have a lot of you passing out the questionnaires to your patients. So let's take a look at these marketing materials and see how they can benefit you. So starting with the brochures, we have trifold brochures that explain both peripheral arterial disease and chronic venous insufficiency to your patients. They also explain the test prep, what the patient can expect during the procedure, and they do talk about the fact that there is no downtime after either study. I think that's important to your patient to know that they can leave the office and resume their normal activities. The patient questionnaires are a great tool for determining risk factors and indications for PADnet and CVI studies. These questionnaires can be handed to the patients after they are brought back to their exam room. The questionnaires do help tell the patient's story, and they often yield information that he or she may not tell you directly. I worked for a podiatrist for about 10 years, and the one thing that I always noticed with my patients is when they come back to the waiting room, they like to be talked to until the doctor comes into the room. A lot of them are older patients. This is kind of their social hour. So handing them the questionnaire helped fill the time while they waited for the doctor to come in. So that was our procedure. Here we have some questions from our 2 questionnaires that you'll be passing out to your patients. We do have copies of these questionnaires available, so if you need any, please let me know, and I'm happy to email those out to you. They're black and white, so they're real easy to make multiple copies of. Remember, as long as your patient checks at least one box, they are able to have a reimbursable study performed. The questionnaires also give you the opportunity to have your patients provide additional information to you by asking probing questions about claudication, rest pain, their history of cardiovascular disease. These questions will also help pull forward relevant risk factors. In addition to questioning your patient, there are also visual cues that you can look for. Here we have a combination of both primary and secondary indications. Our secondary indications include cool, dry, and atrophic skin, skin discoloration, edema, hair loss, and muscle weakness. All of your patients with secondary indications should be given a questionnaire to be filled out. Ulcers and gangrene are primary indications, and these patients should be scheduled immediately for a PADnet study. Patients with chronic venous insufficiency can present with varicose veins or reddish-brown discoloration of the lower extremities. You can also use your ring finger behind the patient's calf to palpate varicose veins that you might not be able to see. Early detection and intervention leads to better patient outcomes. It can prevent cardiovascular complications such as heart attack or stroke. Because atherosclerosis is a systemic process, significant overlap does exist between peripheral arterial disease and other forms of cardiovascular disease, namely cerebrovascular disease and coronary artery disease. Coronary artery disease is present in about 90% of people that have severe PAD. Monitoring and treating your patients can help prevent progressive loss of leg function and even amputation. The prognosis following amputation is quite poor. 2 years following a below knee amputation, 30% of people are dead, 15% have an above knee amputation, 15% have a contralateral amputation, and only 40% of those people will have full mobility. So talking about your EMR is a super powerful tool for generating lists of in-need patients that you already see. Reports can be generated based on diagnosis, such as diabetes, arterial sclerosis, trauma, or vein conditions. And you can generate reports, patient lists, or queries based on certain risk factors, such as smoking or high blood pressure. Remember that your patients with a primary indication can immediately be scheduled for a PADnet study, and those patients on your risk factor list all need to get questionnaires. And as long as they check one of those boxes, they can be scheduled for a study. So taking a look at your TRAKnet, we're going to actually open up a TRAKnet here so you can see how it works, and then you'll get the screenshots with the webinar. So going into TRAKnet, from the home screen, you're going to go to your billing dashboard. And your billing dashboard is your last tab over at the left side of your screen. From there, you're going to go into reporting. And then once your reports menu is opened up, we're going to stick on the first tab here, the reports tab, and we're going to go to patients by diagnosis. When I expand this report, I'm going to click on my details button. And the first thing I'm going to do is select my date range. So your starting date, you'll want that to be October 1st, 2015. The reason you're picking that date is that is the first day that you started using your ICD-10 codes. Your end date will be today's date. Now, entering the diagnosis codes, it's actually super easy to do in TRAKnet. You can run all of your reports that you're going to need for your PADnet studies in about 15 minutes. This is so simple in TRAKnet. So what I'm going to do is I'm just going to minimize this, and I'm going to pull up a Word document that we're also have included here on the webinar. So if you go to your GoToWebinar panel under Handouts, this Word document is found there. If you have trouble getting it for whatever reason, you can email me later, and I can always send this to you. But this walks you step by step through the process. And if you scroll down, you'll see a list of all the codes. And Word makes it very easy to just click inside this box. You'll see when I hover inside this chart, I get a small black arrow. If I click on that, it's going to highlight all of my ICD-10 arterial codes. And I'm going to right-click and copy that. Oh. There we go. Copy, and I'm just going to paste it right into my diagnosis codes section. It does accept all of the codes. There doesn't seem to be a limit as to how many you can run. I'm not actually going to run this because this is actually one of my clients' TRAKnets, and I don't want to pull up their patient information, but you would click the execute button right here, and this would generate a list of all of your patients that have primary diagnoses for an arterial study. After you do that, you can click the export button, and that's going to export it to an Excel spreadsheet. You could also print it right from here if you wanted to. To get rid of all of the codes in this list so you can run your venous patients, you're just going to hit Control-A on your keyboard, and delete will remove all of those codes right out of that box. Then I'll come back here to my Word document, and I'm going to pull up my ICD-10 venous codes. Same way, highlight it, copy, come back into TRAKnet. I'm going to keep my date range the same because these are ICD-10 codes, and I'm going to paste it right here into the diagnosis box. I would simply click execute, and it's going to pull forward all of my patients that have venous indications for a chronic venous insufficiency study. Now, if you're doing your ICD-9 codes, what I normally do for ICD-9 is I normally go back to about January of 2015. You could go back as far as you wanted to, of course. So I would put in a date from 1/1/2015 to September 30th, 2015. Again, I'm going to clear out that diagnosis box by clicking Control-A and delete. And we have your ICD-10 codes listed here as well, your ICD-9 codes listed here as well. What's nice about running this report is this might also show you patients that you haven't seen in a while that you can invite back to your office for PADnet studies. Again, I would simply click execute, hit export, and I have my list of patients. So let's start thinking about your next steps. The first thing you want to make sure is that you have enough trifold brochures. You can order them directly off of our website if you need to order some more. We want to make sure that they're easily visible in your waiting room. I know sometimes it's easy to have them buried underneath magazines and things like that, so we want to make sure that our patients can see them easily. The patient questionnaires. I can't stress enough how important it is to have a procedure in place for this. Like I said, I worked for a podiatrist for 10 years, and it was so easy to forget to hand patients those questionnaires. A lot of times we would think the front desk was doing it, the front desk thought that we were doing it. So assigning one of your groups of staff to hand the patient questionnaires will benefit you tremendously. I think it's best to have the medical assistants do this. They're the ones that have the most interaction with the patients once they come back. As I said earlier, the best time we found for this to happen was after we seated the patient in the waiting room when they were waiting for the doctor. All of our patients over 70 years old automatically got a questionnaire to fill out. What's nice is that you have your questionnaires are about 5 to 7 questions, so it's not like the paperwork that they're getting up front. I find if you're handing them the questionnaire while they're filling out new patient paperwork or paperwork, you know, for their yearly visit or whatever, they get overwhelmed. But when you're just handing them the one questionnaire in the exam room, it's 5 to 7 simple questions. It's not that big of a deal for them at that time. And again, it helps pass the time waiting for the doctor to come in. Remember that your patients that have a PADnet study, as long as they have the primary indications for it, they can get a yearly study. So you'll want to perform a PADnet test on your patients yearly as long as they meet the diagnosis requirements. And data mining your EMR. I would plan to do that 1 or 2 times a year just to make sure that you're keeping up on your patients that need questionnaires. And don't forget to run the risk factors in your TRAKnet as well. Anyone that's on your risk factor list will get a questionnaire as well. So while you can't study that, you can't schedule them immediately for a PADnet study, you can be certain that they do get a questionnaire next time they come in. There are ways in TRAKnet to flag these patients using your alerts in TRAKnet, so when your patient comes in, you'll be reminded that they need to get a questionnaire. Again, don't forget that we have the handouts attached to this webinar. So we have the screenshots for TRAKnet. It will take you step by step on how to run these diagnosis reports. If you need any help, I'm happy to set something up with you. I can help walk you through it. If you need questionnaires emailed to you, please email me after the webinar, and I'm happy to send those to you as well. I am going to unmute everybody at this time, just in case anybody has any questions.
Hello, Deborah.
So I believe we have everybody off mute now, so if anyone has any questions, please feel free to ask at this time.
It looks like that particular series, though, for those DTUs that we have been exposed to.
Okay, if nobody has any questions, we'll go ahead and end the webinar. We do look forward to providing these additional webinar courses, so please check your email to see what ones we're offering next. And as always, please feel free to reach out to me directly. You have my email from the invite, or you can always reach out to our support department. That email is support@biomedics.com. Thanks so much and have a great day.